Knock knock. Hey there. My name is Susan Buchanan. I'm gonna be your student nurse today. Can I have your first and last name?
Lauren Costigan. No.
Oh. And what's your birthday?
9303.
Okay, where are we right now?
Saginaw, Michigan.
Okay, and who's the current president?
Joe Biden.
Okay, you're alert and oriented ×3. That's good. So today I'm going to be doing 3 different assessments. I'm going to be doing a heart or cardiovascular assessment, a lung assessment, and an abdominal assessment. Do you have any questions before I begin?
No.
Okay, before I start, I am going to ask you a few questions. Do you have any medical diagnoses or surgical history I should know about?
No.
Okay, are you having any pain?
No.
Okay, do you smoke or drink?
No.
Okay, and are you prescribed any medications? Are you taking any?
No.
Okay, do you take any herbals, over-the-counters, or supplements?
No.
Okay, fine. Before I begin your assessments, I'm going to go ahead and take your vital signs. I'm going to grab my blood pressure cuff.
Okay.
Sure, no problem. That's my diaphragm. Okay, I got 118/78. That's good. Okay, I'm going to return my blood pressure cuff and I'll be right back. Okay, now I'm going to go ahead and take a radial pulse. You can just put your arm out. Okay, I got a radial pulse of 68, which is good. We're looking for 60 to 100. And I counted your respirations while I took your pulse, and I got 14, and we're looking for 12 to 20, so that's good. Can I take a look at your hands? I see no clubbing, and capillary refill is less than 3 seconds. I don't have a pulse ox, but I would assume your oxygen saturation is anywhere from 96 to 100%. And I don't have a thermometer, but I would assume you're around 98.6 degrees Fahrenheit. All right, I'm gonna go ahead and begin my assessment. We're gonna start with cardiovascular while you're sitting right here. I'm gonna go ahead and start at your carotid arteries. I'm gonna palpate or feel them and then listen with my bell for any bruise or whooshing sounds.
Okay.
Okay. I'm gonna go ahead and feel the left one. Okay, nice and strong, and the right. Nice and strong. I'm gonna go ahead and listen to each with my bell. No bruise. And no bruise noted. Okay, now I'm gonna feel 2 pulse sites on your arms. If you could just go like this. I'm gonna go ahead and start with the brachial. They're strong and symmetrical, and now your radial. Strong and symmetrical. Okay, looks good. Now I'm gonna go ahead and start your lung assessment if you could. Show me your back. Okay, is it okay if I open this a little bit more?
Yep.
Okay. Alright, I'm inspecting the back. Skin's intact. I'm noting a few moles, nothing I'm concerned with. Spine is in the center. Alright, I'm gonna go ahead and test your chest expansion and the symmetry of your breath.
Okay.
So if you could take a deep breath in and out. Okay, it looks symmetrical. Now I'm gonna go ahead and percuss 12 spots, 12 lung fields. I'm avoiding the scapula. Okay, I hear resonance, which is good. I'm gonna go ahead and listen also to those same 12 spots, and I'll stop at 6 to see if you need a break.
Okay.
Every time you feel my diaphragm touch your back, I want you to take a deep breath in and out.
Okay.
I'm listening with my diaphragm. Avoiding the scapula. Do you need a break?
No, I'm okay.
Okay, your lung sounds are clear, that's good. Now if you would go ahead and lay down for me. I'm gonna continue with my cardiovascular assessment. First I'm gonna assess for JVD. I'm gonna take your pillow away if that's okay. And lay your head flat and look to the left for me and the right. Okay, I'm noting no JVD. If I did, I would sit you up and reassess. Okay, I'm gonna go ahead and listen to your heart sounds now.
Okay.
Is it okay if I pull your gown down?
Yep.
Okay, first I'm gonna inspect the chest. Skin's intact, no lesions. I'm noting some moles, but nothing I'm concerned with. Are you having any issues with your chest? Any pain?
No.
Okay. I'll put this side back up. The first heart sound I'm listening for is the aortic heart sound. It's on the right side in the second intercostal space. So this is your clavicle space, rib 1 space, rib 2 space. Okay, I'm gonna go ahead and listen with my diaphragm. I hear lub dub. I'm also gonna listen with my bell for any murmurs. Okay, no murmurs noted. I'll lift this side back up and onto this side. Okay. on the left side. The heart sound I'm going to start with on this side, the second heart sound, is the pulmonic. It's going to be in the second intercostal space. So clavicle, space, first rib, space, second rib, space. Listening with my diaphragm. I hear lub-dub. Switching over to my bell. For murmurs. And no murmurs are noted. Okay, the next heart sound is Erb's point, and that's gonna be in the third intercostal space. So rib 3 and space. Listening with my diaphragm. I hear lub-dub. Switching to my bell. And I hear no murmurs. The next heart sound is the tricuspid. It's going to be in the fourth intercostal space. So fourth rib and fourth intercostal. I'm listening with my diaphragm first. Okay, I hear lub-dub. I'm gonna go ahead and switch to my bell. And I hear no murmur. Okay, the fifth heart sound and the final one is the mitral. I go to the fifth rib and the fifth intercostal. I'm gonna meet with my other finger and in the fifth intercostal space, and it's gonna be mid-clavicular. Listening with my diaphragm for lub-dub. Okay, I hear lub-dub. I'm gonna go ahead and switch to my bell. And I'm noting no murmurs. I'm gonna go ahead and switch back to my diaphragm and listen for 1 full minute to get the apical pulse. Okay, I got an apical pulse of 69, which is comparable to your radial pulse. Okay, we can cover you back up. I'm done listening to your heart sounds now. I'm gonna go ahead and move on to your abdomen. Is it okay if I pull this out? firstly, I'm gonna go ahead and inspect the abdomen from the side, as well as the end, the foot of the bed. Okay, I'm noting no bulging, and it's flat and symmetrical, and the skin's intact. First with the abdomen, I'm gonna go ahead and auscultate with my diaphragm for bowel sounds. So the umbilicus is the midpoint. This is my right lower quadrant. Right upper, left lower. Okay, I heard 5 gurgles. Five gurgles. Five gurgles. And 5 gurgles. Okay, now I'm gonna go ahead and listen to your abdominal arteries. And the abdominal aorta is between the umbilicus and the xiphoid process. I'm gonna listen with my bell for any bruits. Okay, no bruits noted. Next, I'm gonna go ahead and listen to the renal arteries. They are up from the umbilicus and lateral slightly. No bruits noted in the left renal artery. No bruits noted in the right renal artery. I'm going to go ahead and move to the iliac arteries, which are lateral and down from the umbilicus. Okay, no bruits noted. And the left iliac artery. And no bruits noted in the right iliac artery. Okay. I'm done listening. I'm gonna go ahead and percuss 3 spots in each quadrant. If you feel any pain at all, let me know. Okay, I heard generalized tympany. I'm gonna go ahead and find your liver border now. Tympany, tympany, dull, dull. Okay, now I'm gonna palpate or feel your abdomen. First, I'm gonna do it lightly. If you feel any pain, let me know. Any pain?
Mm-mm.
Okay, now I'm gonna go ahead with deep palpation. Okay, looks fine. I'll have you pull this back down. Alright, now I'm gonna go ahead and finish off the cardiovascular assessment. And I'm gonna start with the femoral pulses. Is it okay if I go ahead and feel them?
Yeah.
Okay. So my fingers are right here. Pulse is nice and strong. Can I feel the other side? My fingers are right here. Nice and strong. I'm gonna go ahead and feel them at the same time. All right, they're strong and symmetrical. Now I'm gonna go ahead and listen to them for bruits with my bell. Okay. No bruits noted. I'm gonna go ahead and go to the other side. And no bruits noted. Okay. I'm gonna finish up with the rest of the pulse sites on your legs.
Okay.
And And first we're gonna feel the popliteal. If you could bend your knees for me, thank you. And they're symmetrical and strong. I'm gonna feel the the posterior tibialis. All right, symmetrical and strong. Can I take your socks off?
Yeah.
Okay, and now the dorsalis pedis. All right, symmetrical and strong. Okay, you can go ahead and stop for me. Do you have any questions?
No.
Okay, thank you.